talk about, in fact, you've talked in one of your videos, I think, of the correlation between visceral fat and heart health or pericardial fat. How are they related?
Yeah, so I can show, I have an image of that I can show you as well. So this is a image of an individual that had, in fact, a study on their heart where we specifically used an MRI to evaluate and measure, assess the amount of fat around the heart. So in an MRI scan, fat shows up as white and muscle shows up as dark. So and so do tissue and muscle, other things. So this is the right lung, this is the left lung, and in between your lungs and your chest is your heart. And around this individual's heart is this large chunk of fat. So this fat is called cardiac fat or heart fat, is inflammatory locally to the arteries that are externalized on the outside of the heart. Well known to Dr. Ovadia as a cardiothoracic surgeon, because he would do transplants on those arteries that were diseased, and he would have to cut through this fat to expose those arteries. So this big, huge, it's like a blanket of inflammation or wrap around these arteries causing disease. This individual was able to eliminate dramatically his heart fat utilizing a elimination of processed foods. In this particular case, that's all he did. He's cut out processed foods, most of which were carbohydrates. If you think of processed foods, are almost always carbohydrates in nature. But he eliminated his heart fat in just 13 weeks. So that's a dramatic visual for your audience to be able to see how beneficial eliminating processed foods are with regard to eating or reducing processed foods. So this series is one of my favorites too, that shows how visceral fat itself is eliminated by cutting out those processed foods. And this is the same individual that we did the heart scan on. He was a 68-year-old guy, and all he did was cut out processed foods. So your audience should be able to see this huge amount of visceral fat, and also this big streak of fat within his muscle here, his oblique muscles, how that is eliminated in 35 weeks. So about 7 months or so, he's eliminated that visceral fat by just cutting out processed foods and not exercising at all. Had this dramatic reduction of visceral fat and fat within his muscle, which a lot of people don't know about. But the relationship between visceral fat and heart fat is seen when we would routinely, my practice now, we will scan people's abdomens and we can see the heart fat going away. So here's another client who's got a large amount of visceral fat here and a large amount of fat around his heart. And over the course of 3 months, he goes to having dramatically reduced his visceral fat and dramatically reducing his heart fat. So the association between heart fat and visceral fat is a strong one. And I can almost always predict somebody will have a large amount of heart fat around their heart, inflammatory fat around the heart, if they have a lot of visceral fat.